Hey everyone, welcome to our module on traumatic brain injuries. Before beginning with the video, I would like to let you know that you can get a flat 10% off on UWorld Medical Library and bundled QBank subscriptions using my code Varun10. So this medical library is an extremely useful tool that is very well organized into different subsections that is easy to read and understand with the right amount of figures and tables. So this is something that's integrated with their Q banks all across USMLE Step 1, Step 2, Step 3, and clinical Q banks. It's highly integrated with the Q bank. It's an integrated all in one content. You can just read and then solve questions. You can study smarter with AI powered tools called UAsk, where you can ask anything with just a single prompt. You can explore the medical library using the link that is in the bio, and you can get a 7 days of free trial, and also use my code Varun10 to get a flat 10% off on medical library and bundle QBank and medical library subscriptions. This lecture series is provided free and is open access for everyone. There are no paywalls or mandatory fee. We don't receive any kind of fixed funding from any organization. If you find it useful and wish to support its continued development, you can contribute to us with the link that is on the screen, and that's also pinned in the bio. For audience from outside India, they can contribute to our free USMLE and medical education initiative using this PayPal QR code that is displayed on the screen. So traumatic brain injuries can be classified based on the location of the injury and the vessel that's involved. So understanding these patterns of traumatic brain injuries is very high yield on the USMLE. There are three main types of traumatic brain injuries. These includes epidural hematoma, subdural hematoma, and diffuse axonal injury. So each of these have their own unique mechanism and own unique imaging. Coming to epidural hematoma, so this is nothing but that's caused due to blunt head trauma. Classically, this is associated with temporal bone fracture, and in this epidural hematoma, this mainly involves injury to the middle meningeal artery. Because of very high blood pressure in the arterial lumen, or very high blood pressure of the arterial blood, so blood strips the dura away from the skull and leads to rapid expansion. This rapid expansion leads to increased space that is being occupied by the blood. This could lead to compression of the brain from the blood inside the skull. Because the skull is limited, it can't expand, but so it just compresses the brain, and this rapid expansion leads to compression and features due to compression. These features includes loss of consciousness followed by a lucid interval, and then there is rapid deterioration in these cases. On CT scan, you can find epidural hematoma using a characteristic biconvex lens-shaped collection that doesn't cross the suture lines. It is limited by the suture lines. So this epidural hematoma can be found on CT scan using the characteristic appearance of biconvex lens-shaped collection, and it doesn't cross suture lines because it's limited by sutures. Coming to the subdural hematoma, it's usually due to shearing injury and leading to rupture of the bridging veins. So, epidural hematoma is usually an arterial bleed, whereas subdural hematoma is usually a venous bleed. This venous bleeding is usually low pressure as compared to epidural hematoma. You can read about the subdural and epidural hematomas on UWorld Medical Library. It is highly organized, easy to read, easy to understand, with right amount of images and figures and tables. It makes your learning very much lovable. You can get a flat 10% off on their QBank and medical library subscriptions using my code WORM10. Elderly patients usually carry a risk of subdural hematoma. Patients who are under chronic alcohol use, there's brain atrophy, which leads to stretched bridging veins. So, whenever there's brain atrophy in elderly patients or those uh, chronic alcoholics, there is stretching of the bridging veins, and these stretched bridged veins are usually prone to rupture. So, this increases the risk of rupture and subdural hematoma. Clinical features of subdural hematoma includes headache, confusion. It usually carries a gradual onset and is characterized by focal neurological deficits. So symptoms usually develop gradually and may progress over days to weeks. On CT scan, you can characteristically find subdural hematoma using a characteristic crescent-shaped collection, as you can see in the image. This subdural hematoma usually crosses the suture lines. It's limited by dural folds. It is not limited by suture lines. So it usually crosses sutures, and this leads to a crescent-shaped collection, whereas epidural hematoma is limited by suture line is isn't so it's limited by suture lines, and that leads to a biconvex lens shaped collection, whereas subdural hematoma leads to a crescent shaped collection. Coming to diffuse axonal injury, so it's usually found in cases where there is severe acceleration or deceleration injury. So whenever there is rapid change in velocity, this causes the brain to move within the skull. So whenever this is pure physics, so whenever there's rapid acceleration followed by a sudden deceleration, the brain just moves within the skull, and this could lead to severe acceleration deceleration injury, and that injury is called as diffuse axonal injury. It's due to high impact trauma such as motor vehicle accidents, falling from heights, and in cases of blast injuries, whenever there is sudden force. So shearing forces, they usually affect different parts of the brain. The different parts of the brain move at different speeds. So this leads to stretching and tearing of the axons. So the end result is usually widespread tearing of the axons at the junction of the gray matter and white matter, corpus callosum, and the brainstem. So diffuse axonal injury is caused by shearing forces from rapid acceleration or deceleration, leading to widespread axonal damage. There is axonal damage, usually due to shearing forces that stretch the axons and tear the axons. It's usually found at a gray-white junction. This is the most important thing to remember about diffuse axonal injury. So they are the most vulnerable area due to difference in density and movement between the gray matter and the white matter. Axonal swelling, disruption, and disconnection occur at a microscopic level. There is axonal stretching and tearing leading to microscopic injuries. And they may not be visible on routine imaging initially, but they are usually microscopic, and they occur at the junction of the gray matter and white matter, corpus callosum, and brainstem. This leads to widespread disconnection. So clinical features of diffuse axonal injury includes immediate coma, where there is loss of consciousness which occurs immediately after the injury. There is no recovery of consciousness after injury. There's usually a lucid interval. Unlike epidural hematoma, there is no brief period of loss of consciousness. So whenever there isn't any kind of temporary improvement, coma usually persists, followed by poor prognosis. It is often associated with severe brain injury and high mortality. There is a high risk of death or long-term disability. The most sensitive imaging modality for diffuse axonal injury is MRI. So on axial single weighted MRI, you can actually find multiple microhemorrhages at the gray-white junction, corpus callosum, and the internal capsule, and also the brain stem. So multiple tiny hemorrhages are seen on susceptibility weighted imaging, or GRE. So locations, it usually affects the corpus callosum, internal capsule. There are microhemorrhages in the internal capsule, as you can see in this image. So in this image, you can actually find microhemorrhages in the corpus callosum that are usually hyperdense and opaque. So let's try to differentiate between this epidural hematoma, subdural hematoma, and diffuse axonal injury. This is usually arterial bleed, usually from the middle meningeal artery. This is venous bleed due to the rupture of the bridging veins, and diffuse axonal injury is shearing injury because of severe acceleration or deceleration forces. On lucid interval, you can actually have it's actually followed by a brief loss of consciousness, temporary recovery, and then followed by rapid deterioration. Whereas subdural hematoma is usually slow onset. It usually has a gradual onset for about hours to days. So chronic cases might even be longer. Whereas diffuse axonal injury leads to immediate coma. There isn't any kind of lucid interval. Epidural hematoma is characterized by headache, vomiting, progressive decrease in consciousness, and focal deficits, whereas subdural hematoma usually causes headache, confusion, it usually follows a gradual onset, has a gradual course for about hours to days, and is associated with focal neurological deficits. Whereas diffuse axonal injury is immediate loss of consciousness, there is prolonged coma, there is poor prognosis. And also on epidural hematoma, we usually find uh, that on CT scan we can actually find it using a characteristic biconvex lens shaped appearance on imaging. It doesn't cross the suture lines, it is limited by suture lines. Whereas subdural hematoma is usually crescent shaped, it crosses the suture lines, but it is limited by the dural folds. Whereas diffuse axonal injury, the main modality of imaging is MRI, and on MRI we can find microhemorrhages. Common locations includes the corpus callosum, internal capsule. So finally, epidural hematoma is due to arterial bleed associated with a lucid interval and is lens shaped on CT scan. Whereas subdural hematoma is usually a venous bleed, carries a slow onset, and also on CT scan we can find it using its characteristic crescent shaped appearance. Whereas diffuse axonal injury, there is shearing force followed by immediate coma and microscopic axonal damage. Epidural hematoma doesn't cross suture lines, whereas subdural hematoma crosses the suture lines. So epidural hematoma is limited by the attachment of the dura to the skull, whereas subdural hematoma, so it can cross the suture lines because it is between the dura mater and the arachnoid mater, but it's limited by the dural folds. In the next module, we will be learning about tumors of the nervous system. In this module, we have completed traumatic brain injuries. I hope this video helped you. I'll be right back with another video of our neurology series. Till then, subscribe and keep supporting. Thank you so much. Bye.